Although nursing is not the most glamorous job in the world, it is perhaps one of the most fulfilling. So I walk into my patient's room the other day, and she's pretty unresponsive. Most of the nurses haven't been able to understand why she's not moving or why she's not being responsive to questions. And I personally, as I walked in, I was expecting kind of a lifeless, hypertensive, unresponsive patient. However, I realized soon that she just didn't speak English. She spoke Spanish. So I began talking with her in Spanish, and oh my goodness, she was so encouraging. She had such kindness and sympathy. Um, and it was so encouraging to be able to talk with her. Um, I started asking her questions about my case study, and she was great. She talked about her kids and how she'd been struggling with her mother's death, a divorce with her husband, and trying to walk her kids through understanding what it means to understand like life versus death. And it was like in this moment when I was talking with her that I realized that although hospitals are definitely a place where people go to get better, it's also a place where people go to die. And I don't know, it just struck me as such a privilege to walk through that with people. Like we get to see like, them getting better. Their whole family's like just cheering as they, get better from, whatever disease they have. But they also go to hospitals so they can die as comfortably as possible. Um, Honestly, it's just something that I hadn't thought a lot about as I joined nursing. Um, and this is where, for me, it's so important to have my foundation in Jesus. Because, like, how in the world are you supposed to walk through that without a God who loves you? It'd be so difficult. But anyways, I guess kind of I started thinking about, like, what does it mean to be a Christian nurse? Like, how in the world are we supposed to shine to our patients when we are only allotted 5 to 10 minutes? I just realized our time with our patients is so precious. And I mean, this bleeds into regular life. Like, how can you not see every day, every patient as a divine appointment? Like, sure, as nurses, we, rub dirty bottoms and clean up throw up and blood off of our scrubs, but I mean, you just see the precious, precious children of God. And you see every single day as this divine appointment. Like, how can you not see it as precious, I believe, like, to be a Christian nurse, you have to understand that loving your neighbor, it means just that you love them. You don't just pretend like you like them. You don't just, kind of laugh at their jokes or take blood pressure and walk out. It's walking into a patient's room with kind of this reverence that realizes that you're talking with one of God's kids. Hi, Sarah.
Hi. So are you recording something?
Yeah, I am. This is for health assessment. Professor Sadugi, this is Sarah. Back to what I was saying. I realize that our time with our patients is so precious. And I began to understand that each person reflects God in a unique way that I can't. Like, there's no way that I'm able to reflect the same aspect of God as somebody else. And so as you get to know patients, even the cranky ones, you get to experience aspects of God like you wouldn't without meeting them. For example, I was talking with one of my patients who, she wasn't the brightest, but she was so kind and funny. And sometimes when I'm in the hospital, I forget how important it is to laugh because I am just so caught up in, taking vitals and charting and trying to find bed baths to give. But she just reminded me how important it is to stop, rest, and laugh. Like, enjoy the life that God's given you. God doesn't call us to be sad and busy all the time. He calls us to rest in Him. Come to me, and you will find rest. That's so significant for me. Another thing that has come to my mind is understanding the value of pain. That as nurses, we value pain. It is our indicator that something has to change. And for me, that is so essential to life, that we realize that our pain will show us that there are things in life that we need to change. For example, my whole passion is I would love to deal with leprosy patients, and they can't feel pain. And so with repetitive movements, just like tapping a screen, like, or, tapping the ground or something, just a repetitive movement could cause them to have infection and lose a whole leg because they just don't feel the pain. And we nurses, we understand how important it is for the patient to let us know how they're feeling, because that's really what allows us to help them. And that just is so vital to our lives, that we understand something that's wrong and then change it. I love that as we study science, it allows us to understand our Creator, because we believe that He's the reason why we have science and why medicine makes sense, So for me, understanding science and understanding pharmacology, all of that, it shows me that there is a divine creator who cares about me enough to give my body this internal defense system that that saves my life on a daily basis, and I'm just not even consciously aware of it. So moving on, kind of what kind of attitude should nurses have towards their patients? In my opinion, there are a lot of embittered nurses. I've seen them. And, for example, I had a patient whose blood pressure was dropping, his pulse was dropping pretty steadily. And so I go and I grab a nurse, because the one who I was following, was in a meeting. And I said, excuse me, I need help. My patient, their blood pressure is dropping, and their pulse is down. And she looked at me and she said, "That's not my patient." I just freaked out. I didn't know what to do. And so I kept grabbing nurses until somebody helped, and they were like, "Okay, we are so glad that you called us, because something bad really would have happened." So I now understand that there are some nurses who, I don't even know how to describe it. I don't quite know what was going on for her. I don't want to speak for her, but whose main goal is not helping the patient, which is really sad. But I want to be a nurse who helps students. I want to be a nurse who helps patients who aren't mine, if I'm asked. And I think that it's really hard, but we have to treat those nurses with even more love and more respect, because there's some deficit there. And God calls us to love our enemies. And I don't know if she qualifies as an enemy, but she certainly was an obstacle in my way of trying to help a patient. So in that way, we have got to have our hearts set like Jesus, where there is no patient too sick, there is no patient too dirty for us to help them, to not help them. Do you know what I mean? I just had no idea how grossed out you could get, by some wounds, or patients pooping themselves, and as soon as you're done cleaning them up, they keep pooping. Just things like that. There's no patient that's too bad for us not to help them, because that's truly the way that God sees us. There's no sinner who sinned too much that He can't help them. I personally can't imagine going through nursing school without Jesus. It's hard. It really is. It is a hard program. But waking up every morning and saying, "Okay, God, what do you want me to learn today? How do you want me to reflect you?" Because in the same way that all my patients are unique and reflect an aspect of you, whether they know it or not, I do too. I reflect an aspect of God that could be essential to someone. It could just be saying hello. It could be smiling at the patient, or like giving them some kind of dental care, or giving something to them that, gives them humanity. Even for patients who are on isolation, don that PPE and get in there and give them as much human contact as possible, but safe, So for me, what's been the most enriching and most encouraging Bible verse has been, "Come to me, you who are weary, and I will give you rest." Like, sometimes it's hard because, like, you become addicted to the stress. Like, I remember just, like, the other day going into clinicals and taking on, like, 6 patients, and, like, why did I do that? But, I wanted to help, but, like, now I'm learning, like, okay, let CNAs do their job, let your other nursing students have some patience, and, help people if you feel like you should or you can. But God calls us to take breaks throughout our week, to enjoy life. God doesn't call us to go through nursing school and hate our lives. Like, He calls us to be joyful and to be rested. Because if I'm not filled up, then how can I pour into other people, So yeah, all in all, this whole Christian thing is really working out, especially coupled with nursing school. Yes, it's hard, but as I mess up and as I trudge on through life in addition to academics, I recognize that my worth does not come from my grades. It doesn't come from an A in pharm or like a C in physio. No, I'm just kidding. But seriously, like, it's hard to not put your worth in that. And so, as I go through nursing school, I really want to try and wake up every morning and say, okay, what's true? Number 1, God loves me. Number 2, I'm His kid, and I can't change that. And then number 3 is I can't depend on my own strength. I've tried. It doesn't work. So yeah, I'm really grateful that we got to do this faith integration, because for me, it's been very, it's been good to reflect. And there's one more scripture that I would love to reference. It's Jesus with the adulterous woman, when He catches her in the act, and it's very shameful for her, and she's like, oh my goodness, like, why are you pulling me out? Like, I'm with my husband. And He's like, but you've had 3 husbands. And she's like, oh no, He knows. And like, I feel like there are moments in our lives when we kind of get caught. It could be like as patients where like you're stuck in your illness and you're like, it's all finally caught up to me. Like, now I have diabetes, or oh my gosh, now I have hypertension, or whatever it is. Or like, even as a nurse, if you screw up on medications, or like, especially as you have your clinical instructor and, the nurses and the infectious disease nurses, and it's hard to get kind of caught red-handed. Like, I was in the hallway the other day, and it was like my first day, and I just put on clean gloves, and I was trying to clean something, but I was outside of the room, and I didn't know that you couldn't have clean gloves on in the hallway, and the infectious disease nurses came by, and they were like, what are you doing? I have to go tell your clinical instructor. And like, my clinical instructor was so embarrassed, and I was so embarrassed. It was so bad. And I just remember like going into my next patient's room crying, like, oh, it was the worst. And so it's really hard to be caught kind of red-handed or gloved. But as I kind of want to circle back to the idea of pain, that like, there are people in our lives who can point out deficits. And this is where we can change. And this is where we can become better people. And like, extending on the glove analogy, it's like, I could have hurt people with dirty gloves. And if that wasn't pointed out to me, then it could have been really dangerous. And Jesus does that for us. He really does. Like, we kind of feel like we're caught red-handed, but He reminds us, okay, you know what? It's all right, but change this. because you're called to a higher standard of life and a higher standard of care. Okay, so that's all. All right. I love you, Professor Sadugi.